Hello everybody and welcome to this video on atherosclerosis. This is the first video of a series of videos that will be based on arterial diseases, particularly arterial occlusive diseases. So I'm starting with this topic, the topic of atherosclerosis, because atherosclerosis lays the foundation for arterial occlusive disease. It initiates arterial occlusive disease. And it is very important that you understand how this happens and why it happens. It's a very basic concept, so let's start off with this. So you have your blood vessels, and as you know, your blood vessels have the walls of your blood vessels have three layers. Okay, so we get the tunica intima, the tunica media, and the tunica adventitia on the outside. Your tunica intima is lined with endothelial cells, okay, towards the lumen of the vessel. Okay, let's just say those are the cells. So how this starts is you basically get injury to the endothelial cells. So let's say your cells are injured there. So how does this injury actually happen? So this could be a chemical injury, which, for example, can be caused by chemicals in smoke. So like when you're smoking cigarettes, chemicals are released into your bloodstream. And in fact, smoking is the biggest risk factor for atherosclerosis. You can also get damage to your endothelial cells by, for example, hypertension, where you get high forces of blood, like this high pressure of blood comes and damages your endothelial cells. So then what happens is you get lipids from your bloodstream, so lipids and macrophages, which basically are floating around usually in your circulation. And now that this layer is destroyed, they can go into this intimal layer. So you have a whole lot of lipids and macrophages sitting over there. So when this happens, they keep building up in this layer, okay? So they keep pushing your endothelial cell layer. Okay, so they keep depositing over here. And as you can see, you're occluding this vessel over here. You're making the lumen smaller compared to this part here, where the lumen is bigger. So that already is causing occlusion. Now also what happens is your smooth muscle cells from your intimal layer also start going into this. Sorry, your smooth muscle cells from your media layer start going into your intimal layer. And they start laying down collagen over here. So they make this plaque even bigger. Okay, so obviously that is causing your occlusion there, like I said. Then also what can happen is, especially for example with hypertension or with further injury to your endothelium, this could actually break open. Okay. So what happens is all of these things, all of these cells and other components that were building up over here start going into your vessel. Now that they're in your vessel, they could completely occlude this part over here, okay? And as we will see in the further videos to come, what the consequences of this are, they could be very devastating, okay? They could be acute, they could be chronic. Also, what can happen is these components can actually go elsewhere. They can travel in the circulation and form emboli, okay? So small pieces that will go and occlude smaller vessels. Again, this will cause symptoms depending on where these emboli have settled. What you also need to remember is that when these components are released over here, you get coagulation factors and platelets coming here. that will come to try and stop this process. As they get laid down, they will further contribute to this thrombosis, okay, this clot that has formed there, and they will worsen your symptoms that you're experiencing. Okay, so like I said, depending on the site where this happens or where the emboli travel to, you will get different symptoms. For example, if these go into your coronary arteries, they could cause a myocardial infarction or angina. Then if they go into your cerebral circulation, your vessels in your brain, they could cause a stroke or a transient ischemic attack. If they go to your renal arteries, they could cause renal failure. If they go to your limbs, they can cause intermittent claudication, critical limb ischemia, acute limb ischemia, and so on. And this will be discussed in the further videos to come. And that, guys, is a basic summary of atherosclerosis. Make sure that you know it. You do not want to not know it in front of your seniors or in your exams. It is a very basic concept. Make sure you understand it, okay?